Welcome to the Master Clinical Dentistry Institute, where we train students in each and every field of dentistry.
In this video, we will be discussing about the different prosthodontic questions that arise in the complete denture and that are there in the exams. The first question is, can you please tell the shape and the amount of the distobuccal extension of a complete mandibular edentulous impression is determined during border molding by the options are ramus of the mandible, position and action of masseter muscle, third is the lateral pterygoid muscle, and fourth is the size and the location of the buccal frenum. Now if we look at the options, among them, the lateral pterygoid muscle is one of the masticatory muscles and it is a two-headed fan-shaped muscle. It is located in the infratemporal fossa of the skull. It is one of the four masticatory muscles along with the medial pterygoid temporalis and the masseter. Then comes this masseter muscle. It is a paired, strong, thick muscle that originates from the zygomatic arch and it extends down to the mandibular angle. It is also a masticatory muscle. Its function is basically elevation and protrusion of the mandible. The mandibular buccal frenum in the premolar region, and it corresponds anteriorly to the anterior border of the buccinator muscle. And the buccinator fibers are attached to the mandible and also to the mucogingival junction. Now, the answer for this, it depends upon the position and the action of the masseter muscle, as you can see in this diagram. Now, the next question is, maxillary anterior teeth in a complete denture are usually arranged. The options are facial to the ridge, lingual to the ridge, or exactly over the ridge. Now, the answer is facial to the ridge. Reason being, because the maxillary central incisors, they are the most important teeth in terms of aesthetics, and their placement controls the midline, speaking line, lip support, and smiling. So if they are arranged lingual or they are arranged over the ridge, then the person would have difficulty in pronunciation, and as a result the pronunciation won't be clear and there will be the tipping of the denture. So that is why they are arranged facial to the ridge. Now the next question is, what is the most important benefit of an overdenture? Root retained over denture. The options are the increased retention of the denture. The second is the physiological comfort of avoiding the loss of all teeth. Third is the preservation of the alveolar ridge. And fourth is the improved support and stability of the overdenture. Now, you must be knowing what is an overdenture. Tooth retained overdenture is basically when we preserve two or more teeth in an arch so that the denture can fit upon them. The most important benefit of tooth retained overdenture is that it preserves the alveolar bone in the mouth. The answer to this is the preservation of the alveolar ridge, because in tooth retained overdenture, when we preserve two teeth, the bone height and width is retained. Otherwise, what happens is the bone loss gradual with time. Now the next question is, a plaster index is used to preserve the face pore transfer, maintain the vertical dimension of occlusion, maintain the bite registration, and the next is the all of the above. The purpose of the face bore is to register the relationship of the patient's maxillary arch on three planes of space and transfer this information into an articulator that can be adjusted to simulate the patient's jaw movement. The answer to this is the preserve the face bore transfer. When fabricating dentures, there are two methods used to preserve the face bore transfer. First is take a plaster index and placing a piece of wax there. The plaster index method is the preferred method because due to possible distortion of wax because of the temperature differences. We offer many online and classroom dentistry courses. Among them, few are the removable prosthodontic course, the fixed prosthodontic course, the aesthetic dentistry courses or the smile dental designing course, and the dental implant course. So you can enroll in any.
You can log on to www.masterclinicaldentistry.com, or you can call or WhatsApp on +91 Our institute is located in India. You can also contact us via email, that is masterclinicaldentistry@gmail.com.